guests here that are sitting around here. Legislator Gilson is here sitting in with us. Legislator Bartlett, Legislator Caldwell, Legislator, no, there she is over here. Other people in the position. We'll start with the pledge. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Hope we've all had time to review the last month's minutes. Approved by Legislator Hines, seconded by Legislator Lombardo. We go to HS1. Oh, all in favor?
Aye.
Opposed? Carried. Thank you. HS1, resolution awarding professional services contract RFP 25MH003 court-based mental health navigators. Looking for a motion.
So moved.
Second. Nicole, walk us through this.
Sure. The New York State Office of Mental Health funded the BEGIN initiative last year and funded every county to have what they're calling court-based mental health navigators. We were awarded funding for 2 navigators in Oswego County, which we put out an RFP for this project. The project is to support individuals who have a mental illness, who are going through the criminal justice system, who are living in the community, so they're not in custody, and their charges have not been, they've not been sentenced, their charges have not been resolved. So it's that group of people that are struggling to access services, and the intent of this is to have staff who will engage these individuals, connect them with services, help them go through all the steps of process in the criminal justice system, their hearings and their appointments, their connection with defense counsel, and to continue to work with them until they're either sentenced or charges are disposed of or whatever the case may be. And then refer them on, if they're going to remain in the community, refer them on for additional support services. The overarching goal is to decrease the recidivism rate, decrease the repeat arrests and interactions with law enforcement for those individuals with a mental illness.
This is a completely new program.
Completely new program. It's new for every county. And so we're starting it up brand new, and this is an RFP that was out for this, and we received 2 proposals, one from Catholic Charities and one from St. John's Community Services. Our recommendation is to award it to St. John's Community Services, which St. John's would be a new provider if awarded this contract to Oswego County. They've been a nonprofit agency over 150 years. They've been in New York State for 7 years, and they're currently in Tompkins County in Ithaca, and they are providing housing services, some case management services. They also run a New York State OASIS licensed community residence for adults in recovery from addictions, and they are looking to meet local needs in other counties in the state. And so they've been participating with Oswego County in our committees and planning efforts for a couple of years now. And this was an opportunity that they were interested in and felt was a good alignment with their strengths and their current services. And their proposal was scored higher than the other proposal, and we are recommending their St. John's Community Services. The funding amount is set by New York State OMH. It was explicitly stated in the RFP, so their proposal matches that stated funding amount.
Okay. Ed, you had a question?
Is this a state mandated program?
I could probably say no and turn the money back, but they are strongly pressuring counties to stand this up. But I would not say it's a mandated program.
Thank you.
They're going to establish an office here locally.
Yes.
Okay, Richard.
By reading through this, I've got a question here because I'm a little confused. increasing number of individuals with behavioral health services needed are not engaging with treatment and support services. Now, just from what they're saying, is this is kind of voluntary for these people?
Correct, it's a voluntary, their participation would be voluntary.
Who tells them they have to go there?
I mean, how are we
Yeah,
connect
how
with
are they
them?
guided into their
Okay,
system?
so the navigators are going to develop work relationships with the courts, the district attorney's office, assigned counsel, public defenders. So they'll be educating those entities about this service. They will receive referrals from them. They'll also be present in courts for arraignments and be able to let people know about their services and educate the judges about the available services.
All right, then moving on in that same paragraph, mental illness having repeat interactions with law enforcement and incarcerations, et cetera, et cetera. Generally, the law enforcement doesn't get involved unless there's an active crime or charges. Now, why are we getting increases? I mean, this county's losing population bleeding fast.
Law enforcement is frequently interacting when we have a person in emotional distress to the community. Individuals themselves, people that care about their neighbors are contacting 911, who are then dispatching law enforcement and or ambulance to respond to that need in the community. They assist individuals in getting them to the hospital for an emergency mental health evaluation. They assist them with connecting with mobile crisis service as well to try to prevent the need to go to the hospital. So they're interacting with them frequently when there's no crime necessarily. Also interaction when there is a crime committed, but they have a lot of interactions.
Well, I'm a little, let me put it this way. Because I've had to deal with this a little bit now and then from different individuals. The minute the person goes on my property, that's trespassing. Okay, that's a crime right there. So it's not something that's been, I created, they created it. Okay. Is there a correlation, because some of these people belong, I'm sorry, some of them need constant treatment, like up in Marcy and the health system that they have up there off 291. Is there a correlation between the fact that how much mental health institutions have been closed and the number of people that are needing these services?
I don't believe so. I think the closures in those facilities happened a long time ago. This is an issue of maybe not adequate access to community-based services. There are significant wait lists for clinic patient treatment services. Housing programs to support individuals have significant wait lists as well.
Because I happen to know one individual that's spending some time or vacation time in mid-state, and he's a constant problem. And he belongs here before something probably happens. So, this, I don't mind funding this, but I want to see some results on this. I want some of these people out of the community because they're a hidden store community.
This project, the Office of Mental Health has funded this project and created an entire data collection system that this staff, these navigators, are going to have to enter all of that information in. People's criminal history, their participation in the program, their linkages and outcomes, the outcome of their court proceedings, and all of that is being tracked into what New York State calls a REDCap system.
Who oversees these navigators? You?
Well, it'll be a contract, hopefully, with St. John's Community Services, so they'd be supervising them directly, but my office would be involved in establishing the program and working with the agency to do that. We'd be monitoring their performance of the execution of the deliverables and so.
Because a lot of these people, it just repeats and repeats and repeats. And our citizens end up being the victims.
And that's because of that issue, and because the state's aware of that and has reviewed the data, that's how they created the service and how they identified how many navigators each county got. So was awarded for funding. So because of our numbers here, we received 2 navigators to do this work. Other counties only got 1. Some counties have shared, like a couple of navigators over a series of counties.
So not all counties are having the trouble that we are having, or all counties having the same issue?
They're all having the same issue to a different volume. They also have different populations as well.
What's that, Richard?
No, that's all right.
Understand. Ed?
So you refer to they. Who's they that determined the need for this?
The New York State Office of Mental Health and their Criminal Diversion Division.
So our Department of Science Council and Public Defender's Office, and is it able to handle the alignment of these individuals that need help?
But this is a real direct hands-on service to be able to, we're hoping that those officers will connect people that they're working with to this service, but the navigators are going to be the hands-on connection with folks to get them linked to services, help them go through the process of accessing services, get better understanding of what their needs are and their barriers are to accessing those
Would you
services and help them
say it
overcome
would
them.
be like a drug treatment court, but for mental illness, that the same way that we connect in drug treatment court with the judges and the law enforcement
Yeah.
agencies, that we are doing this, but at the mental health capacity, because the state does provide these recidivism rates. And our county has a high rate of recidivism. Now, is it correlated to substance use disorder and mental health? Highly likely.
Yes.
But what kinds of services can we put in place to reduce it? And they're recommending this service, and they're gonna give us the money to do it.
So just to follow up, how did this happen prior to this being passed?
How do
How did these people get help to this point?
they make a referral to, maybe to an outpatient clinic on their behalf, the defense counsel, maybe.
So this is
maybe
not a duplication of any services?
No, this is in addition to that, it's in partnership with the existing system, but to take it another step farther, to really see those referrals and those linkages through, help people to continue to participate in them.
Thank you.
Richard?
Now, the navigator is basically like a liaison between the court and this individual, or whatever the case may be. What kind of authority does that navigator have to make that person go to treatment?
No, it's a
No.
voluntary program.
All right, so it's still, we're still basically back to square one. These people need help and they don't want to go get it. Maybe they don't want to get off the substance. I don't know what the issue is. Don't care. The problem is it's not going to change.
It's not going to be a service that everybody is going to engage with. I 100% agree with you. It's a voluntary service, and the navigators, people who will be hired for that, the skill set that we'll be looking for is people who have those very effective engagement skills, understanding where people are at, what's important to them, and we're using soft skills to engage them with the necessary services that they need.
So you mentioned earlier, Nicole, that outpatient clinics. So I think what we're seeing is that they're strained. People, even if they wanted to voluntarily go seek help, are on a waiting list for a very long time. So something like this
We'll have to
carves
accept
out,
that, too.
yeah, carves out a space for those people who can't get the service.
Joe?
Is there follow-up? Is there follow-up with the coordinators? With the people that are going to services? Is there follow-up?
Follow up to see if they're participating in the recommended services?
Correct.
Yes, absolutely. That's part of the role.
I think it's a good service.
Noel?
Oh, Jim's.
Oh, yeah, it might have been handled, or answered, I should say. Is this available, per se, like in arraignments too, or is it only after the judge or someone calls?
No, they can be present at arraignment, at cap court, that
So,
sort of thing.
but again, who would identify that need for that person to be there? It's not gonna be like there at every camp court.
No, they're not going to be, obviously not going to be able to do that with 2 navigators to cover all of those. But that's providing the information to everybody else who is at court, and hopefully they're going to identify. But they don't have to know have documented evidence or medical records that somebody has a mental illness. If there's some general belief that somebody's struggling with that, they can make the referral to this service.
Currently, there's a number that law enforcement, 231,
941.
941. So this would be in conjunction with that, perhaps.
It's hopefully the goal would be to reduce some of
Right.
those 941. Yes.
But I think it's important to at least have the availability for rain.
This is going to be very interesting, being a brand-new program. And all these questions that are asked, very entertaining questions and very necessary. And collection of the data is going to be key, because I'm sure it's going to come up in discussion at the end of the year about renewing again in the next 2 years.
And much like we want to know what the data is to inform whether or not this is having an impact.
Right.
At the state level, they want the same thing. In order to continue funding it, they're going to need to have the data that supports that
Right.
it's having an impact statewide.
Well,
I was just gonna ask, what's the expected salary for the two positions? And what experience or education are they gonna need? And what do you expect the caseload to run? How many, like, is there a lot of individuals that would be utilizing the service?
The caseload is a little bit, because it's new, it's a bit of an unknown, based on the number of people who meet the criteria and then how many are willing to participate in the service. So that part is a bit of an unknown. And they can be open with the service until their charges are disposed of in one way or another.
Oh, okay.
When they're sentenced or they're dropped, at that point, the service comes to an end. And they would refer them to other services in the community if they're going to remain in the community. There's the two positions. There's a senior navigator and a navigator. The senior navigator salary is budgeted in the proposal at $65,000 and the navigator at $50,000.
And so the total amount here is $140,000 from May 1st to the end of the year.
Right, because it's not a full year. We'll be starting in May
Right.
1st. So annually, it's $204,869.
Thank you.
Richard, do you have any more?
We can talk about this all day.
Got it. Does anybody else have any questions? Well, if not, all in favor?
Aye.
Opposed? Carried.
Thank you.
Thank you. HS2 is a resolution for budget modification to move funding from the Division of Mental Hygiene to Veterans Service Agency. Is there a motion?
So moved.
Eric, could you talk on this, please?
Yes, so last month we were able to get the peer mentor position approved. We weren't able to get this one in quite in time, but the funding, since we're the office that's going to be running this Dwyer program, in order for us to even get started, we need this funding, and this is going to allow the Office of Mental Hygiene to put that money into our budget plan so that we are able to start purchasing the stuff that we need and pay for the salary of the peer mentor. My senior VSO, I think I talked about this last month, Ward Bowen has decided to take that position as a peer mentor, and we've hired a new VSO that's going to start April 13th. But I can't move him to that position until I get the funding to pay his salary.
Right.
So we're kind of at a standstill right now.
Anybody have any questions for Eric about this? The peer mentor program is going to be fantastic. It's very, very necessary for our veterans to have it alongside. All in favor?
Aye.
Opposed? Carried. HS3, resolution authorizing acceptance of rental supplemental program RSP funds and approving a budget modification for the Department of Social Services. Appropriate motion.
So moved.
Second.
Lee, you walk us through this.
Yep, so this is the rental supplement program under Gidget's department. This is money that we received from OTDA. And this is for families experiencing homeless or facing imminent housing loss. did you want to add anything more, Gidget, about why we're bringing this forward?
So the Office of Temporary and Disability Assistance provides this allocation annually. This is the 4th year that they've provided this funding to Oswego County, and it is to provide a rental supplement for people to move into permanent housing, which is obviously a lot cheaper than keeping them in temporary housing assistance. So this is a request to accept that funding so we can continue it again for the 26-27 year. The majority of this funds is a direct service to clients. There's a small administrative amount that the county is allowed to use to offset some of the staffing costs because we do administer the program.
Okay, these are strictly rental
Yes,
places.
rental, yes.
Anybody have any questions? Richard?
Now, you said this is generally yearly, correct?
Correct,
Do we usually run out of this?
yes. We
What
could-
have then?
So the program requires that when I enroll somebody, I have to guarantee that they are paid for the entire year. So we track it, and we only enroll enough people that we can cover for the entire year. So we have an internal tracking system that every month, so if I enroll you in February, then I have to run that rent right through to December. I don't pay it all up front, but I have to allocate for it, right, and expend it. If we close somebody out, then I can enroll somebody else into the program. Right now, we have 32 households enrolled, and we are at full capacity right now for the amount of money that we're receiving.
How many people have on a waiting list?
Well, we don't really create a waiting list. We open up applications once we have open slots. And most of those referrals come internal from the people that we are housing in either shelters or hotel motels. So we work closely with our adult protective. We work closely with my housing team and try to move people out of temporary housing into permanent housing with this funding.
Joe, you have a question?
Where do you find the housing?
We don't. We can work with the client. We connect with landlords, but we don't actually find that housing for them. But we do have certain landlords in our communities that do work with us and accept payments from the agency. So the landlord would have to be willing to do that in order to participate.
That's across the whole county.
Correct, yes.
Thank you.
Yep.
Chris?
How do you determine eligibility? How do you pick those 32 families?
So
First come, first served?
yes, it's a referral system internally. They have to be at below 50% of the average median income, and 30% of their income is required to pay like a client share. So if they're getting Social Security, for example, and their Social Security is $1,000 a month, then they would contribute $300. We would pay the difference up to 85%.
So what's the average stay for someone in temporary housing?
Now, long. We have people in temporary housing upwards of 6 months because people on temporary assistance and fixed incomes like SSI and SSDI cannot afford permanent housing in this county. Our fair market rate right now in Oswego County is higher than Onondagas.
So what's their incentive to get out of it?
To live in permanent housing. We do have case managers that the state also now gives us other funding to case manage them and try to work with them. But as a household, especially families with children, their incentive is just to get into something that's stable. And we do the best we can with the resources we have to try to get them there. Yep.
So you say this temporary housing is like hotels?
We have 2 small shelters in Oswego County, one for males, one for females, and the rest of the people in Oswego County are in hotel or motels, yes.
That's got to be more expensive than a permanent?
It's very expensive.
Any other questions? Richard?
What's the recidivism rate of that?
Of people in hotels,
No, they keep needing to be on this temporary. You get the same people going.
we do sometimes. I mean, yeah, there are, like any other community service, you have people who we see more often than not. Mental health challenges, substance use disorder challenges. We now have 2 parent households with income, both working, that are in hotels because they can't afford to put their families in an apartment. So you're seeing more and more of it because of the cost of living in the community.
Why is our cost of living higher than Onondaga County? Or is it because of lack of?
It's probably a little bit of both. I think that we all can recognize that after the pandemic, and the eviction moratorium was lifted, we saw a lot of rental increases across New York State go through the roof. So, you know, unfortunately, in a smaller county that's rural like ours, a lot of times people can't afford those $1,400, $1,500 a month rental, especially on fixed income. So you start to see them needing more and more community support.
$1,400 or $1,500 for a two-bedroom is actually reasonable.
True, but when your SSI rate is $1,200 or Social Security is $1,400,
That's irrelevant.
but then they
I look
can't
at it
afford it,
from a
right?
different angle, and that's why I sold all my rentals,
Right.
because it just costs too much to keep them.
Yeah,
Get rid of them.
but
And they all know they're owned by private people, there's nobody
Mhm.
rent. I mean, sucks to them, I'm sorry, I got rid of
yeah,
it.
permanent housing is difficult to obtain right now in the county.
Go well.
Well, I was first.
So, we have some that are 6 months. Is there a legal limit? Is there a cutoff?
So if you are in shelter, after 30 days, they do have to request an extension from the agency. We review their case management profiles to see if they've been actively searching and if they're just struggling. So we do have oversight, but typically we're giving extensions because the other options are then to just put them in hotel motels because we are required to shelter them. As long as they're compliant with program rules, we are under obligation to shelter them.
So, and then just to follow up, the final question is, where do they go from here?
The homeless people,
Yeah, if they move out of our temporary housing, where are they going?
well, some are going into permanent housing, some are leaving the area. If they find, we do work with Hugo and Onondaga County as part of our homeless housing coalition. So there are certain people who may come up on the list. We call it a coordinated entry list. And if there's available housing in another county that they're willing to accept, they are allowed to move because we work in partnership with those other 2 counties.
Do you need more money allocated to that program?
This money comes from the state. I mean, I'm always willing to take local dollars if you guys want to start a local rental supplement program.
That was my
Yeah.
Time today.
I want you to go up and buy.
But this is all from the state, so I'm only asking you to accept the state money today. I'm not asking you to give me any local.
My question's real quick. Is there any tracking of where these people come from? So are they county residents already? Are they coming from outside the county to here?
So I'm not tracking now, Noel, but that was a large data set that I did collect during the pandemic and after for the first couple of years. We were doing a lobby survey asking people, why are you applying? Have you recently moved to this county? Have you recently moved to this state? And we saw small numbers of people coming from other counties. And most of the ones we did see were typically domestic violence related or moving to be closer to a support system.
Oh, I think that needs to be tracked if possible.
Yeah, I did do a lobby survey for approximately 5 years.
Would I be correct in saying that if they're coming in and you're trying to find them to get to support systems, you want them on the bus line then?
We do. We try to find that. Transportation has made great improvements over the last few years in Oswego County. You know, Heather and her team have really tried to create bus lines. If we have, we actually had a hotel open up that was willing to work with us, and she worked with the transportation system to get that on a bus line. So we do work closely with mobility management to help serve those so that they can get, you know, access to stores, to doctors, to the school systems.
Any other questions?
So you got, this is 43,000, right?
432,000.
432,000.
Yes.
Can you get that bumped up?
I mean, we submit quarterly reports to the state. So when they see we're utilizing money, if they have extra money, they will reallocate it. But I think most of the counties are probably using what's being given to them. But I do, when I attend our annual conferences, we do consistently ask for additional funds to come in for this program.
Any other questions? All in favor? Opposed? Carried. Okay, moving on to the committee review on things. The first thing is appointment of members to the Oswego County Long-Term Care Council. 17 reappointments. Sarah, could you walk us through that?
Sure, as part of our New York Next program that we have, it's a requirement to have a long-term care council. The council needs to discuss long-term care issues or where there may be gaps in services, come together as a group to discuss that. So it's a pretty long list, 17 people, because people have been on the committee for a long time, so we haven't had replacements. So these are reappointments from basically the inception of the long-term care council.
Right. Do we have any questions about the appointments, reappointments?
And they're community members, you know, from social services, from our office. We have people who are utilizing services, as well as from transportation, from Catholic Charities, from everywhere. And we don't have a limit on the number of people that can participate in the council.
All in favor of it? Opposed? Carried. The second one is vendor use of the Albert Asian Kitchen located at 74 Front Street in Oswego. I know that goes to infrastructure. Tell us about it.
Excuse me, yes. I just wanted to let you know that we're going into a lease agreement with the Oswego County Opportunities. They are our meal congregate site vendor. So they'll be coming in utilizing the new kitchen at our space at 74 Bunner Street. They'll be there on Tuesdays and Wednesdays, meals for our elder, those 60 and older who reserve. So this is the agreement for them to utilize that space and lay down the groundwork, what they're responsible for, what we're responsible for as a county, and for the next 2 years.
Anybody have any questions on that? All right.
Is there a fee associated with this?
There is no fee for OCO, the vendor to come in and utilize that space. It's just, it helps not increasing the cost of the meals that are being provided overall. This is adding a site without removing any other site available in the county. So now it would be 6 congregate sites as opposed, or sorry, 7 as opposed to 6 that were previous.
Thank you.
Anybody else? All right. Boarding department. Social services, B.
I do have a presenter. Megan Rose is our new Director of Protective Services. So she is taking Sarah's position, and she is here to talk about Protective Services.
All right, thank you, Lee. Hi, like Lee said, I'm Megan Rose. I am the new Director of Protective Services at DSS. Protective Services, we oversee both child protective services and adult services. We also have support services for our entire services division under the Protective Services unit. So within our child protective unit, we have 3 grade B supervisors that oversee the unit. They're broken down into 3 teams. So our 1 team is our general rotation team. Any reports of child abuse and neglect that come in from the state are assigned to our caseworkers. We have 4 seniors there. They are supervising our caseworkers, supervising their work with those reports. And those are our general cases of child neglect. So those are maybe lack of supervision, messy house, or educational neglect. We then have our specialty teams. So we have our DEC, which is our Drug Endangered Children team. Any reports that we get that allege substance use by parents go to that team. So this is a specialized team. They've had a lot of training related to identifying substance abuse and to connecting those families to services. Also on our specialty teams, we have our MDT, that is our multidisciplinary team, that takes all of our abuse cases, sexual abuse, severe physical abuse. And over the last couple of years, we've expanded that, so they are taking any medical neglect of children that have significant medical issues, developmentally disabled children, children with speech issues so that they can't be traditionally interviewed. They all go to our MDT because they are specialized. They have years of experience with forensic interviewing. They're able to look through those medical notes and really understand what we're reading. So we felt that was a really important way to expand our MDT. Our MDT grade B supervisor who oversees those two teams also oversees our partnership with the Sheriff's Department for our deputy. He's stationed right at DSS. He goes out with our CPS caseworkers and our family services caseworkers on those cases that perhaps there might be a weapon in the home, or we have a history of this person being aggressive towards our caseworkers. They will go right out with the deputy who's stationed right there and just be an extra layer of protection. We also have our training teams, which is another unit with a grade B supervisor. We have our onboarding team. Every caseworker that comes into DSS goes straight to the onboarding team, regardless of if they'll be at CPS or if they'll be at family services. So all of their initial upfront training, both internally and state training, is all overseen in that team. Once they graduate from that training, we have a CPS training team specifically. So once they're ready to take on their reports, they move to that team so that senior can really walk them through the process, go out with them and really teach them how to be a caseworker in the field. We also have our closing team. So this team takes over any cases that perhaps we had a caseworker that resigned or that moved to another division. Now we have a team that those cases go to so that they can still be worked on and closed. Any questions about CPS before I move on? Yes, sir.
You work with family court on some of these issues?
Yes, we do.
All right, and they are privy to all that information, so they can make decisions on certain issues.
Correct. So we filed neglect and abuse petitions in family court. That petition really lays out the allegations. So any cases that we have that rise to the level of needing family court intervention, maybe it's because we feel the family needs some extra services and they're not willing, or because whatever it is that happened is really egregious and needs that family court intervention, we'll file this petition. So the court gets all the information that's in our petition. Part of the protective unit is we have a legal support team. 2 senior caseworkers are stationed right at family court, and they are the liaison between the court and between CPS. So we will provide them with updates that they can then relate to the court. We also write updates to send to the court for each appearance. Anything else?
No, as long as we can avoid the couple cases we had that didn't end up so well.
We have a lot of things in place to streamline any communication with the court and to ensure that we are getting into the court. We have built a really robust legal team now. We have several attorneys. We even have a supervising attorney who's stationed right at DSS. So anytime our staff need counsel on a case, she's right there.
Ed, you have a question?
Oh, sorry.
Yeah, we're seeing increased economic pressure on families,
Correct.
constituents and all. Are you seeing a rise in the need for protective services? Is there a correlation there, do you see? Is it on the increase?
Our numbers have really stayed stable. We get reports each month, and there's general fluctuations. Like last week was the week before spring break. We see a rise in CPS reports during that week because a lot of teachers are going off for the week and they want to make sure that if there's any concerns, they make that report. But overall, numbers have been pretty steady year to year.
Thank you.
What is their average caseload now?
I'm sorry?
The caseload, average caseload?
Oh, average caseload. So our goal is to have every case worker at 15 or under. We have a lot of caseworkers that are maintaining that 15 or under, especially on our 2 specialty teams. Our closing team has higher caseloads because they're getting all of those cases from caseworkers that have left. Or sometimes when things are really busy, a caseworker might get 5 reports in a week. So you get 5 reports in a week. After a couple weeks, your caseload goes high. We'll move some of those cases over to the closing team. So their caseloads run between 20 and 30, just because they're helping get those cases closed. We do have a few outstanding caseworkers that might have a caseload of 30 because of things like that happened, or they were out on medical and got, subsequent reports on their cases. And again, that's where we have that closing team come in and support them so that we can get those cases moved along.
Thank you.
So also under protective services is adult services. We have 10 caseworkers in that unit. 3 of them are rep payees. Just stepping into this role, I've recently learned that our rep payees for Oswego County, the number is incredibly high compared to other counties. Our rep payees are really taking on any cases to do financial management. Maybe it's a case that we have guardianship of the client, or just a case where a person receives SSI and there's a concern with the spending. They end up being homeless, or somebody else is their payee and not using their funds appropriately. So they will get a rep payee assigned to ESS. We also receive referrals. It could be from a community member, a doctor's office, could be from a neighbor about concerns with adults. They could be, to adults that are elderly, adults that have disabilities, and we'll go out and investigate that, assess that, determine if they need services or if they need connection to community-based services. Questions about it all?
Can you just talk a little bit about the statistics? So you talked about the closing team, and I think recently, Tiffany, I think you were the one who actually provided me some information as a result of an audit that we did with Laura, who is in the QA department, but she was in the QA division before we did the restructure, and she was responsible for closing cases. And so could you could tell me, because she might have to.
She just kind of told us what the numbers were, a year and a half ago versus now.
Yep.
I actually did come prepared for that. So it was a year ago. I looked at the stats from March of 25 compared to now. March of 25, we had 947 open child protective reports. 575 of those were overdue. Now when she did the stats, and it was for this meeting, so it would have been February stats, 606 open reports, so down over 300 open reports, and 273 overdue. So again, down 300 overdue reports in the last year.
So that closing team is working, right? The concept of what they are doing is actually having a positive impact.
Thank you. You're welcome. Anything else?
Very
Thank you
good.
very
Thank
much.
you for bringing her along. Thank you, Megan.
Thank you.
Okay, so it's me now. So I just did want to take a moment to welcome Felicia Melendez as my new confidential administrative assistant to support executive operations, communication, and coordination. Felicia, how long have you been with us now? Including,
6 years.
6 years. And so I pulled her up from integrated services downstairs in the Medicaid division. And so I'm happy to have her because she has some useful knowledge. I think that will be important in this role with some of the calls that come in. And she will also be overseeing, her job has changed a little bit from the previous role that Kaylee had. We've added, she will also be doing some work for our finance director as well. So she'll be coordinating efforts between the two of us. So welcome aboard, Felicia. So I did establish the executive strategy team. This team includes myself, the deputy commissioner, the director of administration, compliance administrator, and the finance director. And this is really for us to align operations, policy, and fiscal oversight. We are continuing restructuring within administration and child support to strengthen supervision, clarify roles, and improve operational consistency. Targeted operational alignment initiatives include standardized phone messaging to ensure accurate and consistent communication with the public. I realized that I had gotten a call from Kelly Jordal about our phone system and a complaint that had come in. And so in the fashion, I decided to call the number to see where it took me. And boy, it took me right down a rabbit hole. And so what we realized is that there are some legacy processes out there that need to be refreshed. And so that's what we're doing. The team is now coordinated, working on how phone calls will get routed, making sure that the messages are accurate. And so I think we'll see some improvement with the phone system. Advancing document management improvements, including eFax transition and file organization. So I want to say last year sometime IT brought on eFaxing. And so we also realized through me calling the phone lines that in one of the messages, a staff was leaving 2 fax numbers. And when I asked the staff, why 2 fax numbers? And their response was, well, back in the day when one broke down, we had the other one. And so again, it's just a legacy issue, something that has been overlooked for a lot of years, but we're going to get on top of that now. Implementing role-based access and structured data management practices to improve accountability. So part of that initiative did start under Tiffany when she was down in the role in integrated Director of Integrated Services Admin, and working with the IT department, this idea that when people come in, you know, I'm Lee Sullivan and I have all these permissions, but let's make it a role. This is the commissioner's role, this is the deputy's role, this is the caseworker's role, and if you're a caseworker, you're going to come in and have these specific permissions. So we're just working on organizing information, transitioning to division level monthly reporting to improve accuracy, ownership, and timelines, reinforce communication standards across leadership, including professionalism, consistency, and FOIL awareness in all written communication. So just recognizing as an entity that anybody could FOIL an email. And so we all have to be very cautious about, you know, some people may be less formal in an email communication, and just reminders that, you know, that formality has to remain. Program highlights, services division, foster parent recruitment and certification efforts continue, with 13 families completing training and several moving forward in the certification process, strengthening local placement and capacity. We are looking at the 12-week certification program after speaking with Foster Life Ministries. I had to look at you to remember the name. Foster Life Ministries, I met with them this month to gain feedback about some of the barriers or concerns that foster parents who attend their support group are having. And so we're going to take a look at that certification, that there may be likely some gaps in that, and try to help support the foster families better, because we need them so greatly. Integrated services, continued progress in case management, supporting self-sufficiency, including households securing housing, individuals gaining employment, and increased participation in work and education activities. Child support, ongoing strong performance, exceeding federal benchmarks with high compliance rates and continued collections, supporting families in county reimbursement. Crisis response and child welfare. We did issue a request, an RFP for crisis respite services to expand local capacity and provide appropriate short-term stabilization options for youth. I did send out to Phil and Noel and Mike. It's garnering attention in the media now, with several publications having been posted across the state. This is not an Oswego County issue. It is state-specific. It is a statewide systems failure issue. So I'm glad to see some momentum being carried forward in that. Okay, so there's 3 prongs to this RFP for crisis respite. Obviously, you know, having children in ER extended stays is not sustainable for our county, especially if we can't draw down reimbursement. But we also have foster parents who are taking on the difficult job of accepting these children into their homes, and they need support. And so having the ability to get a break from that. Some of these kids are complex kids and they have other children in their care. And so this will also help to support those families and maybe avoid those hospital placements, because more often than not, it is the foster parents who are leaving the kids in the ER because of the extreme behaviors. But additionally, we also have the CAC who deals with children who've been sex trafficked, and so this respite program could also help support those initiatives as well. So I feel like it's really a three-pronged presentation. Transportation and cost efficiency. So we did complete a request for information for transportation services to evaluate cost-effective options and improve oversight. We did conduct staff training on March 26th with Howard Snow from Mobility Management to reinforce use of lower cost transportation alternatives and reduce reliance on higher cost cab services. So I'll continue to update you on those initiatives, but we expect to have some savings as a result of that, in addition to being able to cap some of the expenses that the cab companies in charging no-show fees, which could be, you know, what it costs for the ride, but up to $150 if there's a no-show call fee, which is pretty expensive. So that's why we're looking into it. Community and partner engagement. On March 25th, we met with Julie Chetney from Elemental Management along with DSS leadership to address Medicaid timeline placement and service coordination. Last year, there was some significant backlog with chronic Medicaid, and I think that we are going to see a little bit of that now because we do have some staffing issues in that department. Not to mention me stealing Felicia from that department. So we may have a little bit of backlog, but Felicia's going to help out when she can. On March 19th, we participated in the Superintendent School District meeting with regional education partners to strengthen collaboration and early intervention efforts. We did identify some new systems that the Compliance, Quality Assurance and Compliance Director has come up with that has some escalation forms and tools and QR codes that make it easy for people to get in touch with us. Safety and facility coordination. I did meet with Sheriff Don Hilton and Under Sheriff on March 27th, and that was to talk about safety concerns at our facility. Immediate actions underway include signage, enforcement, alignment, and strengthened staff safety protocols. Continued planning for long-term lobby redesign and parking lot improvements. Ongoing improvements to DSS phone system to enhance reliability and resident access. Continued focus on clear communication and call handling to better serve the public. We expect that Eva's going to really help with that as well. Gidget's been spearheading this expansion for us, so I just want to shout out to her and thank her for that, because we're really excited for Eva to get up and running and kind of be to be the person who's answering our main line out at DSS. I think it will resolve some of the concerns that we've had recently. Compliance and quality assurance activities. The division has conducted targeted fiscal process and reconciliation audits, including CANS-related review and documentation tracking, completed transportation costs and routing review to identify efficiency opportunities to cost drivers, ongoing case practice and documentation reviews with services to assess timeliness, accuracy, and compliance with standards, review of contracted service oversight and billing practices to ensure alignment with scope and expectations, and identification of process improvements with corrective action, tracking, and leadership follow-up. Technology and modernization, continued advancement of internal systems to improve efficiency and service delivery, implementation planning for electronic evaluation tools to support consistency and accountability. Myself, the compliance director, and the finance director are going to be going to Tyler Connect conference in Las Vegas. and we're hoping to look at and identify more efficiencies within the Munis application for us to be able to apply. So we are excited about that. External funding and advocacy, submitted multiple grant requests through federal partners, including Senator Schumer, Senator Gillibrand, and Congresswoman Tenney, and funding requests that support facility improvement, transportation access, and service delivery enhancement. So I believe the Senator Schumer, I requested 3.5 million. Senator Gillibrand was 3, and Congresswoman Tenney was 2.5. And then Heather Snow and I are collaborating on some transportation funds because we are a recognized hub, even outside of DSS operational hours. Central and the county transit use our location as a drop-off and pickup, and that's what these funds are directed for, and that's $1.5 million, and that would redesign the overflow parking lot. That would include additional parking, but also a bus shelter so that after hours drop-off and pickups could happen there at the smaller lot, and redesign the entire flow of the current parking lot. It's a bad design, and so we're hoping if we can capture those funds, we can improve that. So that's what we've been up to in a nutshell. I did just want to, it's been a hot item, the ER information, and I just wanted to tell you that we do have a person that we're talking about. Phil and I are going to be meeting with one of the hospitals this week about a child who's currently in the ER, and I just want to kind of highlight the extent of work that happens behind the scenes when this is going on. 48 agencies have been contacted. There's been a total of 90 plus calls, emails, and follow-ups. We've looked locally in Oswego, 7 contiguous counties statewide and out of state in Pennsylvania. We have not secured any placements. We have 1 wait list at Children's Village. There is a conditional acceptance. Unfortunately, we learned that due to the safety risk, that's not going to happen. We do, I did identify that there are some barriers. So the majority of the denials due to inability to manage type 1 diabetes and the need for 24/7 nursing. No bed availability. Foster homes, QRTPs, and residential programs report no openings. Program mismatch, incorrect level of care, age or school limitations. So just to kind of give you the grasp of all of the kinds of details that go in with providing placement. Contract access issues, county contract restrictions, insurance barriers for out-of-state placements. And then multiple agencies have not responded despite our repeated attempts to find placement options. I think what we're seeing is repeated or recanvassing of the same providers with no change in availability, weekly follow-ups with agencies, continued denials or no capacity, youth placed on lists, no actual opening available, ongoing outreach efforts, high staff time, and resource use. The fiscal impact, no available capacity for medically complex youth, ER hospital functioning as a default placement. The staffing burden is continuous canvassing and coordination required. The cost impact is high cost, non-reimbursable setting, right? So if somebody is cleared medically and they're still left in the hospital, we can't bill insurance and we can't draw down the funding to pay for it. So the lack of appropriate crisis respite or medically supported placement is going to continue to be a problem. I already stated that it's a statewide capacity gap, but it certainly reinforces the need for crisis respite. Now, some might wonder, why don't we do have the ability and often do staff children at Camp Foundations, and that requires us to have staff monitor people 24 hours. So if you're talking about this particular case where you have a child who has a medical concern, we don't have staff who are certified to administer that medication. But let's just, for giggles, why don't we just work that out? So based on a 35-hour work week, we would need to assign 9 to 10 staff to maintain that 24/7 coverage. Obviously, we wouldn't be able to do that without additional hours and overtime. The estimated cover for 75 days, so we have this young kid, he's beyond the 60-day mark, which is why I picked 75 days, because I thought he was close to that. But we had a child who was in the hospital for 29 days, and we got charged $104,000. So for our team to do it, let's just say somehow we managed, or let's say it wasn't a kid who had this medical diagnosis and didn't need his insulin shot. The estimated cover for 75 days for us to do it would be between $135,000 and $165,000 to do that, and that doesn't include medical care. So if in fact these kids require the medical care, I don't know how we'd figure that out. So I think sometimes people think, well, why don't we just staff them? So I just wanted to let you know that our staff are not licensed to manage insulin-dependent diabetes, which creates additional liability in a non-medical setting. So it definitely creates a system strain for us when you talk about having to take 9 or 10 staff and now we're going to place them outside of those assigned caseloads where we're trying to keep them at 15. So when these issues happen, and there are times we've had to staff children this year already multiple times, where staff are, and we try to do it with as little overtime as possible. If I can get 5 or 6 staff to do 5 additional hours and they're doing their 5 additional hours at the site to be able to provide that wraparound service, we are doing that. But it certainly creates a strain on our system as well then. So I just wanted to kind of, I don't think it would be any cheaper if we could do it in-house versus what the hospitals are charging us now, which is on average $1,500 a day.
Richard, yeah.
Covered a lot.
Yeah.
Quick questions, or actually it's a long question, that's in there. What safety concerns do you have requiring our sheriff and undersheriff to be involved in these? Is it because you're afraid of people coming in, or is it?
So we contract with them. They provide us our lobby service. So we've had a couple of things happen at the site. Back in December, we had a woman who was threatening staff who had been asked to leave the premises but was coming back day after day, standing by our employee entrance saying she was going to bring her posse, waiting for a staff member to come out. And I think there was some gaps in communication, or at least like whose role is what's role, right? So what are my staff doing in those scenarios versus the security that we hire to secure our facility? And was that limited to the lobby? Does it include the front stoop? Does it include the parking lot? And so I think those kinds of scope of work weren't really clear. And we recently had an issue where a young man and his dog set up his tent on our front stoop right in front of our doorway. The buses were arriving, people were coming up the stairs, this young man was in his tent with his dog barking, and one of our staff came in and approached the deputies and asked if anybody had addressed it, and was kind of, got into a little bit of a confrontation over whose responsibility that was. So the sheriff and I met to kind of look at the scope and have a better, clearer understanding of what my staff need to do and what his staff needs to do, because they are responsible for people to safely access our facility. And so if people have to walk past a person in a tent, I don't know if he has drugs in there, I don't know what he's doing in that tent. but he had a large dog and it was barking, and there was some concern for people to safely have to walk around his shanty to get into our facility.
Why was he there?
Because he's homeless, and we have a
Why
nice little cubby
didn't we
hole.
arrest him for trespassing? We own the building.
Yeah, well, you have to have signs up that indicate that. People can't be trespassing, which we have, consulted with the county attorney, and we can have signs. We just haven't been able to acquire the signs. So, Don said he was gonna try to help us with that, because, again, he can't kick people off the property if we don't have no trespassing, or at least that, your presence on the property is for while we're open, right, after hours. So this young man was out there for 3 days, and what he was doing was waiting till we all left at night, and then he would set up his tent. And I think the first day and second day, he was packing up before anybody got there, so we weren't really, I think people knew he was out there, but he wasn't a barrier. On the third day, he became a barrier, and so we needed to address that. And so I think there are some legacy things that are going on that we just need to straighten out and clarify. If weapons are found around the building, what are we doing? If my employee finds a knife outside, are we giving it to the police department, or what are we doing with the weapons? So it was just for clarification.
Right, and the lady you said was showing up every day, what was the issue there?
She was just an unhappy customer, right? So things weren't going her way, and she was letting her frustrations known.
Lee?
Commissioner, our highway department has a sign shop, so you could just
Yes.
work with Sean, you can have the signs made out quicker than having to go buy them.
Okay, so we can talk to Sean.
All right, now, you hit on foster care.
Mhm.
Is it, maybe it was changed, I'm not aware, but do these kids still age out at 18?
Yes.
And what are we doing with those kids? Or what's happened besides they become homeless?
Megan, do you want to jump in there? She's raising her hand.
Yes. So if we have children in foster care at the age of 18, they can stay in foster care up until 21. However, they have to be attending school or working or something like that. We can support them up until 21.
Who verifies what they're working on?
If they are freed for adoption, so if they are freed children and their parents' rights have been
They're
terminated,
what kind of children?
freed, so they're freed
Oh,
from, freed for adoption.
Okay.
So their parents' rights have been terminated. So if that's the case, then our foster care workers monitor and support that child, and they are the ones that will be verifying that. If it's a child that their parents' rights were not terminated, then we have caseworkers that remain involved, family services caseworkers that would monitor if they were in a school program or working, and would continue to support them with establishing themselves to get their own housing, to be independent. So it's not like 18 and then they're on their own. We continue to support.
The foster care group contacted me some time ago, and we were able to set up an appointment. They came out and sat with me and discussed their concerns about that. And it all goes right back to the respite that aspect, because their only respite they have are other foster parents. And when that doesn't happen, that ends up with this. So they're just looking to go beyond that. A lot of things go on out there.
Yeah.
A lot of things, a lot of realignments and stuff like that. The simplest thing on here, but I'll tell you, if you go out there very often, as I have been, is the parking lot. Because you have to circle that thing forever, and maybe you get a parking space, and maybe you don't. And you can line up with the other, I have the data about how many illegally parked cars there are out there every day. It isn't just a peak time, it's every day, Monday through Friday. Even in the expanded parking lot, they're all over the grass. They're everywhere. So as simple as it seems, people are there are workers, afraid they're going to be late, and then people coming there for services, they're already in a bad place anyway. And have that, on top of that, just step into it before you get there. Main thing with the small item, but it's huge. Jim?
Thank you. For those that don't know, last couple of years, our highway department was kind of instrumental in getting that parking lot across the street going. I was working with Rick Dalton. There's a couple things in the mix. But stealing a little bit of my thunder, that's what I wanted to talk to you after the meeting today.
Yep.
But certainly that's a concern, and work towards that, your group, highway, ourselves and things. It's being thought of.
Well, I'm hoping that funding, if we can secure
Right.
funding, that's gonna be a big win.
We
So
like
I'm
funding.
hoping, as lucky as Heather's been, it's gonna come our way too.
So do you have security cameras on the outside of the building?
Yes, we do have security. We did talk about that. We did talk about some other things, because we have panic buttons out there. And it was kind of funny, because when we went out to the interview booth, and we asked the deputy about the panic button, well, he didn't know what it sounded like, because we hadn't had to press it, right? So I got to press the panic button.
So is there also cameras on the parking lots or just the building?
Yep, there's cameras in the parking lot, and I think that would be part of what we would want to continue if we were able to get a redesign. Although I do caution people in thinking that a camera is security. It is not.
No.
We have staff who work beyond the 4 o'clock hour, because we do have very strict schedules. So there are staff that are leaving at 5:30 at night, and there isn't any security at the building. And so we do have homeless people who come there, who hope to see if they can stick in a nice little cozy corner away from windbreaks. And so I just think that the other part of it is getting the training for the staff. We have a new, Tiffany, remind me the name of the training that you're going to go to? Trust is a new training that is geared towards the staff, for them to be able to gain some better skills.
Richard?
Frank, doesn't Mexico have the municipality have a police department? No more?
Any other questions?
But we did do now, the sheriff has added to the schedule, somebody is going to drive to the parking lot after hours in the evening, just to make sure that somebody isn't waiting and kind of setting up their little homestead on our steps. So he is going to drive through, so that's a change as a result of the conversation. So it was a really good, productive meeting.
Yeah, I was out there the 3 days that gentleman came down on the front steps. Dog got to move the dog from the main entrance over to the side, because people aren't going to go up those stairs with this. It was a pretty good sign. Okay, Veterans Services, Eric.
So our regular day-to-day, with the spring coming, we are seeing a slight increase in phone calls and visitors. Since the last shutdown in October last year, one of the issues that we are having is the claims are taking longer. Specifically our higher level reviews. To give a quick on how that works, if you file a claim and it's denied, you have 3 options: do a supplemental claim, a higher level review, or go to the board. A supplemental claim can only be submitted if you have new and relevant evidence. A lot of times what we're arguing is just the decision that was made by the CMP examiner, because the evidence we presented to them already goes against what they're saying. So in that case, we have to submit the higher level review. A normal initial claim would clear in, I'd say, 2 to 4 months. A supplemental claim, 1 to 3. The higher level review claims now, though, are taking up to 6 months. And that's just for the reviewer to review it. Once the reviewer reviews it and finds the error, then it becomes a supplemental claim. We've got another 1 to 3 months. So we're seeing that drag these claims out. It's not creating a backlog for us so much, since we're still getting the claims in, but it's creating a longer list of open claims for our office. And so we're tracking more claims because they're not closing the way we want. Now, we are winning quite a few of those, so that's the good news. The other thing with if you want to go to the board, that's 4 to 6 years, so we try to avoid that at all costs. So, I lost my train of thought now. Well, it's working out good for us. The V seems to be going after veterans. We have veterans that have claims that are already approved, and now we're getting notifications, or the veterans get notifications where they're questioning the CMP doctor's decisions, or they're questioning the rater's decisions. And a lot of these veterans, they're coming to us because they can end up owing a lot of money. If it's what's called a clear and unmistakable error. If he finds a clear and unmistakable error, and that error was 4 years ago, or something was rated and it shouldn't have been, or something was rated too high, they'll go all the way back to that point and change that rating. And they can charge that veteran and make them return all that money that they overpaid. Now, we can submit waivers. Some of them are approved, some of them are not. They seem to be doing that a lot more. There also seems to be more and more errors, and I don't know if that's because after the shutdown they hired newer people and things just aren't being done correctly. But that's that in a nutshell and how that's going. We're still, winning a lot of claims. We're still helping a lot of veterans. With the Dwyer program, as I mentioned earlier, Ward has moved to that peer mentor position, or he's moving to it once we get this all done. He has already started reaching out to other communities. We actually had a chance to go to a board meeting here where we met with some people, and we had a huge number of those individuals reach out to us. They're offering us places where we can hold meetings if we want. They're inviting us to their coffee talks or their pancake breakfasts and stuff like that. So it's really getting out there that this is going to be a good thing for these veterans, and it's giving us that connection to those benefits or those things that these veterans might need to assist them. So once we get this funding portion, the new BSO that's coming in, we're hoping to have spun out by June, July timeframe. That can take a while because they have to be accredited by the VA. They have to go through so much training. So by August, hopefully everything's just done. We're running the way we're supposed to run. It's going to be tough with only having the 2 BSOs now being teams until Emily gets accredited and spun out. But I don't foresee any problems. I don't foresee any complaints. If somebody wants to complain, that's all.
Well, a week from Thursday at our meeting, and we passed that resolution to move that money, and you can get started to have that person award going to be starting at mentor position.
Yeah, Emily starts on the 13th. That's what we're hoping. So we're cutting it a little close there.
Little bit.
Yeah, we'll get it done. We'll get it done. I don't doubt it.
Do we have any questions for her? Sarah, office?
Okay. Well, I passed around some literature, a little brief update, and as I was reading it, as I was sitting here, I noticed I have some typos, and please forgive me. Spell check if it's spelled right, but it's the wrong verb or wrong text, overlooked, so I do apologize for that. I guess probably my biggest update is we're just so happy that there's a guard at our entrance. So there's someone there. That door, our new main door at the other end of the building is now usable. And if you know who you are, the guard will push the button so you don't even have to open the door, which is lovely. So we're very happy for that. Next on the list, that would be for signage. And I know Rick Dolan went around with the new, with a sign provider, vendor, to do a final count and look around the space. So hopefully that'll be an item that we can check off so that we'll have a big Office for the Aging, Public Defender sign over the door so people know which door to utilize to come in. We do have, on nicer days, we do have a sandwich board that's out there that says OFA entrance, but on, being up at Bunner Street with the wind that comes off and the rain, we don't always have it outside. But yes, that was huge, and we're so happy and grateful that that door is now usable. We We did our congregate dining site in Central Square. It will be opening at its new location on April 6th, which is at the First Baptist Church at 701 North Main Street. As I stated at the previous meeting, the site that we were at on Route 11, the church closed its doors, so they had to evacuate. We have temporary site at the American Legion right now, so that meals are still being provided, and they'll be moving over to their new location, new permanent location on April 6th. Our site, we talked about earlier, the lease, so the new Oswego site, we will be opening May 12th. There will be a open house on May 6th to show everybody what the site is, to drum up business, to let everyone, young and old alike, come take a look and see what they can expect by coming to that, the dining center. It'll be open, or the dining center itself will be open between 11 a.m. and 1 p.m. They'll be serving a lunch, a hot lunch, or in the summer, maybe a cool lunch. And if the participant is assessed as needing an evening meal as well, we'll be able to provide them with a to-go evening meal, sandwich type meal for them to bring home. But there will be, the biggest thing is not the meal at the site, it's bringing people together. It addresses isolationism, loneliness, and I don't know about all of you, I know that it's harder to make friends when you get older if you're not involved in clubs and associations. So it's going to bring people together so you can maybe meet some new friends and establish those friendships outside of the site as well. We received one nomination for a couple for Senior of the Year. So James and Karen O'Brien, their names have been submitted to the State Office for the Aging. There are Oswego County Seniors of the Year, and they'll be going to the state. They'll be recognized at the state as well on May 26th in Albany. But we'll also be recognizing them, hopefully, if they're accommodating and would like to, at the May legislature meeting, which May is Older Americans Month as well. So we're happy to have received that nomination. They are substitute home delivered meal drivers, but they also work with a garden club. And if anybody's been through Fulton in the last couple of years, the garden club has really done a really great job with making it more attractive in the city of Fulton. And also work with Spirit Volunteer at the Pratt House Museum. At the last meeting, I mentioned that we're having a desk audit by NYSOFA. So they evaluated 2 of our programs. It was transportation as well as case management for our caregiver services. The programs themselves, no issues at all. They did give me a corrective action because I had no formal policy for how we monitor those programs. We have an informal policy. We monitor, all of our monitoring documents were completed in the correct time. Everything was there, but we had no formal policy in how we did it. So that policy has been written and it's been submitted to the state. So check that box off. Our next evaluation is April 21st through the 23rd, and that's when they're going to be evaluating our nutrition program. So they'll be going to the kitchen in Mexico. They will be going on a home delivered meal route to make sure that the meals the temperatures are being taken the way they should be. They'll also be participating at a congregate meal site to make sure that all the signage is correct, that there's opportunity to contribute to the cost of services. They'll be looking at the menus, making sure the nutrition analysis is correct, making sure that there's not too much salt, there's enough potassium. So they'll be looking at the whole meal program. And then in May, they'll be looking at all of our programs that we have. There'll be another visit in May to look at all of our programs. So they said they could spread them out. And I was like, no, just put it back to back to back. You might as well get them all over again. Then just a couple other things I wanted to touch upon. So we are working with Living with Dementia CNY to bring a caregiver summit. It will be at our facility at 74 Bunner Street, and they will have people there for, because a lot of times caregivers can't attend items because they are a caregiver. The care receiver cannot be without them. So we have space in our new space so that the caregiver can go to the summit, and then their care receiver can come, and there'll be someone there to work with them. We have puzzles, we have games, we have, paint sets, but they will be able to bring their care receiver so that they can attend this workshop. We are fully staffed now. Our last employee started today. It's a case manager. Once they're fully trained, then our 280 home delivered meal clients that are with the case manager now will be transitioned to this staff member. The case manager that had the home delivered meals, they'll be transitioning fully into home care. So we'll be able to add additional home care clients in. Right now, you're limited when you're a case manager with how many hours you have in your day, as social services can attest to. So we have been limited in the number of in-home care aid clients that we can take on because of the case management side. So we'll be adding some additional people on very soon once they're all up to snuff. Public Health Week is next week, and Office for the Aging, I'm working with the health department, so we'll be presenting on April 7th on OFA programs in the evening, and then on April 9th, again in the evening, we'll be presenting on caregiver services, because they really are, there's a lot to talk about with caregiver services, so I'll have a separate meeting, or a separate presentation really was needed to pull out. And I wanted to, in your packet, there's a listing of all of our congregate dining sites with the days that they're open, as well as if transportation is provided on those days. Also in your packet, I just put together some 2025 highlights of services provided, so you can see some of the great work that staff are doing. And I wanted to say Ward reached out to us today from the Dwyer program. He stopped in and asked about our computer lab, and we're going to work with him until your site is all up and fully functioning at your new space to be able to let veterans come in and utilize our computer lab for accessing veterans to their services online. They don't have a computer, so we'll be opening that up so they can utilize that space.
That's fantastic. I want to comment on the tour of the facility out in Mexico last week. That was fantastic. It was very eye-opening to go in there and you hear about a facility that produces 1,200 meals a day. And then you see it firsthand. And the place was spotless, was so well kept, so incredibly organized. Every part of the facility was organized and neat. Thank you, that was great. And that was the first time you had that tour?
Yes, that's the first time they've had that open house in the kitchen, so it was great and it was nice. I had it on my list. I wanted to say thank you for everyone. I saw a lot of familiar faces there, so to go out and see that. I had to leave a little bit early, so someone came later. I missed you, but it was nice to see so many people go out because it is really a process from start to finish to see all the pieces and how they fit together and how it's a well-oiled machine to get those meals out every day. Because a majority, I would say 90% of the meals that are shipped out of there are home delivered or congregate meals, but they also have anytime meals that for private pay. They also do some of the managed care contracts for people who have Medicaid that can have a meal as part of it. So those are not under our umbrella, but they have many different pieces and different parts, moving parts all at the same time to get that out the door. So it is really a great operation.
Richard? Well, you have a question. Okay, anyone else have a question? Sarah? Let's go to Brian.
All right, so I passed out a packet before, so I promise I'm not going through a lot of that. There's some reading material for you. I have a board meeting coming up. It was supposed to be last week. I was scheduling with my director's report that I have in there. So highlighting a few things that are on there, updating Camp Hollis. Right now the numbers now are 242 for registrants. So the numbers continue climbing. That was still in March, and we're getting close to capacity, getting close to halfway point. As you'll see going through there's different things on there. Independence Trail, one thing I wanted to talk about, we are going to partner with Rosemont Gifford Zoo again, and City BOCES on May 15th. We'll do a trail cleanup day as well as work on the trail. A couple things to know. We are working with City, and the students are building benches and creating signage that we're working with Rosemont Gifford Zoo on, and that'll be on facts on the environment and different things that, different habitat that live in our area to highlight those things. And it's important, a couple things on that, is Rosemont Gifford picks a site every year, and this is the second year they picked us to do it. So it's a big event where they get different volunteers. Aside from what we have, they'll get different volunteers to put in work that day. Novellis, for example, has been a big supporter. Also, for those of you who have been on this committee or part of the legislature, you're probably familiar that a couple years ago, we introduced a bug out at Independence Trail to kill another bug, for lack of better words. Well, they're coming back to study that bug next week to see how that's happening, or next month to see how that's happening. It's across the state, but we were one of the sites that, it's the hemlock beetle that they're coming in to study to see if it's doing its job. So that'll be happening out there. So for whatever reason, there will be signage up, but if you get a phone call from anybody, let them know what these white boxes are in the trees. Those are what those will be for, and I'll talk about that more once I have the actual information to go off of. We've had different Easter events happening. Recently, last weekend, we had one in Hannibal. Went well. For anybody that went, you may have known Mr. Bunny, but that was there. We have another one coming up this weekend at Legends Field that we're partnering with the Sioux County Early Childhood Alliance on. So there's a flyer if you want one on that. There is no cutoff on who can attend that event because obviously Legends is pretty big, so we would be able to spread out for that event if anybody's interested. Also last week with the weather being good, Chenango was up to Legends to do their yearly maintenance on the turf. So what they do to that is they bring in machinery to go through and fluff it all and get out any stains and any rips or anything along the line they're able to repair. So that's always important with wear and tear coming off the winter. It's still covering it for 5 months to be able to go about doing that. Another thing is just recently released is our girls softball program will be starting again. So here's a flyer for that to go, as well as another flyer that we're looking for volunteers. So programs like this to keep the pricing down. It's always good, like Little League, to find volunteers that can work with that. So there's information for that as well. Sligo City School District, I met with them recently, walked the complex, gave them the keys to the fields that they'll be using. The varsity and JV sports have already started, modified starts, I want to say April 7th. So the fields will be full. After that, we anticipate 5 days a week, there'll be 3, 4, 5 teams practicing or playing up there every day. We'll have a food truck up there. The batting cages are up and running. We got those put together. I don't know if you saw the press release that the county put out that the Sheriff's Department and the Sligo City Police Department had their cadets up there last week for community service, and they got the batting cages all put together, which is great. So now we're able to work with that. The leadership of Sligo County group also will be up there 2 different days. They're up there this past Saturday, and they'll be up there in 2 weeks. And their community service project is, again, working at Legends Field, so helping to get that open. We are also running a Bridge League baseball program this year that will start July 1st and run through September. So, for example, if you have a grandchild who plays Little League and they're done in June, but they're still around, they want to play throughout the summer, this is a gap where they can play. And that'll happen at Legends Field as well, at days where we're not, it'll run like Little League, but not compete to that. We did submit a grant recently to New York State Parks to apply for a new playground at Legends Field and also parking lot lights. So we're waiting to hear on that. We just closed the grant with New York State Parks on the Camp Hollis winterization project that was finally completed. Paperwork is all in. They have everything they need. So that's all done. We out to Camp Serby. Now the snow is clearing out of there. We are getting pickleball courts set up to hopefully get those new courts set up. We will be moving some kayaks and canoes to Camp Serby. Likely next month, I'll be coming to you about a opportunity we have for acquiring some additional kayaks and canoes. So that's something we're in the process of working with. The capital project 1225, the Legends Field expansion. We've been meeting weekly up there to address the condition of the facilities. I mean, I think the facilities are in great shape. I mean, from my life playing baseball or whatever it may be, the fields are fine, ready to roll. I think the problem is, from talking to the contractor, he is worried about putting heavy equipment still on the outfield without ripping it up, so he's still evaluating it, but I've been told it's only about a 4 or 5 day. Once they get that done, to get it completed. I've been sharing information with him that Champions has been providing to me different opportunities to acquire sod or things to that matter, so we can quickly get that done. But that has all been put in place. Let's see, also for Capital Project 126 for the upgrade to the lighting at Legends. We have 2 bids in, we're waiting on a third, and then hoping to get that off the ground quickly so that we can get that done within the next couple of weeks to repair the broken lights that we currently have. Our New York State Youth Council on March 16th presented in the governor's office. They had 2, I talked to you a little bit about this before, they had 2 topics, youth mental health in schools and youth and AI. Both went really well. I think the youth and AI one was very receptive to the government as to the interest in that. And then, as many in this room can tell you, the youth mental health in schools, again, reminding New York State that, not my words, but somebody else's, that we're Purdue's graveyard for that we don't have the services that, for example, I had a student in my one of my programs who was a junior, was 100 people deep on her wait list in her school. So you can probably tell me you're not going to make a FedEx transcript. That 100's not going to go down that quickly. So whether that child ever gets services is a big question mark. So again, bringing it to New York State's attention that in different parts of the state it may be fine, but for here, there's still some challenges out there that we're dealing with. So that was highlighted within their presentation. We also have a new group that's getting off the ground. It's called the Student Athlete Leadership Council, and that is just getting going. I have a New Vision student who is helping us get that off the ground. Was one of Section 3's Athletes of the Year, so one of the athletes that will focus on recruiting, helping to get it going. We have some leaders, so Fulton, Hannibal, and Oswego right now helping to put it together. Yeah. Almost done. Today started our color cup at Camp Hollis. There was 24 kids who have attended this week-long program. 6 kids did not come, but they assured us they will be there tomorrow because 30 was the cutoff for the amount that they would accommodate. So that is happening this week. What else do we have? The Youth Career Summit, which will be on June 4th. Again, we're going to talk a little bit about that. Some of you may have participated in it, or I've advocated that for 8th graders across Otsego County to learn about opportunities that are available here in Otsego County. Last week, I met up to Legends with the chair with emphasis sports lighting. Bill had hit me off in January to a NISAC webinar that they had on outdated lights in sports facilities in New York State. I did attend that. got a follow-up email from Miss Ephesus Lighting. They met us up there last week. They did a quick walkthrough. They seem to have some ideas for us. They're going to get some numbers back to me, which I will share with you. They kind of, correct me if I'm wrong, they kind of presented it, it's kind of like leasing a car. We would lease the equipment from them instead of buying it. And then they would be responsible for all maintenance,
Correct.
upgrades, everything along the line. So we'll keep you posted on that, but the big piece to go along with that is it also said that they can cut our energy efficiency bill almost in half, basically. So we'll see how that works. Right now I have Rick looking into an issue at Camp Hollis on Grid National Grid that we had a new underground service put in out to Camp Hollis in December, and my December to January bill is absolutely insane, so something's not right out there, so they have to take a look at that. Because nothing's running out there, literally, so there's no explanation at all for it. So Rick, I think, we signed something, so we're doing that. And then last thing, Camp Zerby, we are getting new tee boxes and signage, which is phase 2 of the Bisbee Disc Golf Course is being done this spring. To have that completed. We'll have the youth league running this summer, and it is being used quite frequently by others. I've seen pictures posted on social media. And lastly, Saturday, for those of you who are big fans of Super Mario, you can go see the Super Mario movie that we have going on through the Youth Bureau. If it's available at 9 a.m. on Saturday, yes, it's Saturday, April 4th. It's a flyer on that for anybody who's interested. And lastly, again, I keep saying lastly, the City versus County softball game at the Pitchett will be coming up. If you have not signed up, please do so. I know my friend Jessica has signed up and is determined that the county is not going to lose when she is playing in this game.
Yeah, we do have ringers.
We do. We are stacking our team.
Yeah.
When you run a youth bureau, you have youth that work for you who play high school baseball. So anyway, they play. My kid may have been asked to play. Anyways, that's I have heard that Rodrigo signed up to play recently. So
The white signed up.
Roy signed up to play. So no pressure on the rest of
He
it.
can't be a musician.
Oh, he's just gonna sing the national anthem.
Maybe.
Let's hope.
That's a good thing. But anyways, we're going into the summer. We're getting very busy with a lot of different things, and we're seeing a lot of movement with a lot of good stuff happening.
We have so many things. There's a lot of this on the website.
Yes,
How do people
better
become
be, because
aware?
I send my email to my staff every day telling them that the update.
She's getting the information out.
We have a calendar on there. Every time the event pops up that I don't see on there, about the nicest day.
Do we have any questions for Brian? Richard?
Richard met his quota today.
He's tired. I'm looking for the appropriate motion.
Motion adjourned.
Thank you, everyone.
Well, I kept saying